Welcome to Shape of the City. I'm Clover Frederick and I'll be your host. The Community Health Endowment of Lincoln recently released a report on a community mapping project called Place Matters, showing life expectancy in Lincoln can vary nearly 30 years from one neighborhood to another. Joining me today to tell us more about it are Lori Seibel, President and CEO of Community Health Endowment, and Steve Frederick from Lincoln-Lancaster County Health Department. Thank you both for joining me today.
You're welcome.
Now let's start with Lori. Tell me, how did Place Matters get started and what inspired it?
Well, you know, there is so much work being done in Lincoln to understand what's happening here and to understand our growing city. And so we just wanted to be able to get personal with the city and to take some of the work that's been done with other planning projects and go a little bit deeper. And so we chose to do that through maps.
Okay. Now, what was covered in the community mapping project?
Well, we looked at some of the traditional indicators of health, like healthcare coverage, whether or not you have access to healthcare. But then with mapping, we're able to look at where that access takes place geographically in the community. And then we were also able to look at what they call social determinants of health, things like poverty and crime.
Okay. Now, what were some of the surprising things you learned through this project?
Well, I think it's everyone's own impression of whether they were surprising or not. I think everyone's impression was different. Certainly people have focused on the life expectancy issues and the disparity that exists among our neighbors and our neighborhoods. But I think when you look at the causal factors associated with that, it makes more sense.
Okay. Now, who was all involved in putting together this report?
Well, it absolutely was a partnership between the Lincoln-Lancaster County Health Department, Steve's group there, and he'll talk more about them, I'm sure, and NeighborWorks Lincoln, who is such a strong working organization in the heart of our city, as well as the Urban Development Department for the City of Lincoln.
Okay. Now, let's talk to Steve a little bit. Sure. Tell us about Lincoln-Lancaster County Health Department's role in this project.
Well, actually it was my staff, Raju Kakralapudi, our public health epidemiologist, and Deb Byrne, our GIS analyst, who did a lot of the work on the maps. The speaker the other day said there's a lot of work that goes into these, so they spent hours and hours on working on maps that were requested. Once one map is made, it's amazing how many questions get asked, and so you start bringing in more and more maps.
Sure. Now, what did you find most alarming that helped you put this together?
Well, I wouldn't say anything necessarily that it was alarming. Obviously, there were some areas that were highlighted, like life expectancy differences. There's always going to be those high poverty areas and then the growth of poverty over time. As Lori said, those are some of the key factors for health. I mean, education in some ways is the key to higher incomes and also in being basically good consumers and taking care of your health. And if we find where areas that perhaps have the lower income, they also have lower education, and those factors actually have an impact long-term on life expectancy.
Okay, now how will this project inform the health department's programs going forward?
Okay, well, right now we're in the midst of a MAP process, which is mobilizing for action through planning and partnership. It's really a community health assessment. We're actually about 3/4 of the way through looking at the data, and we're also looking at what people's perceptions are of the quality of life in Lincoln, and then bringing in some of the partners to talk about how strong our public health system is. So we're using the maps to inform people in terms of the health status and some of the indicators, and then we will set priorities for things that we know we can probably do in a 3 to 5 year period, and that'll be part of our community health improvement plan, which is a process that we go through every 3 to 5 years.
Okay, very good. Now going back to Lori for a minute. So it sounds like there's several different maps that have been created. What do they all mean sort of collectively?
Well, like Steve said, there are maps that create questions, that create more maps, that create more questions. And so what we do have are over 100 maps. Mm-hmm. And when you start layering them, you can start seeing why certain neighborhoods are more impacted than others. It's not a single answer. There's not a single way to address a problem or an issue in a community. It's multi-factors. And so when we begin to see these maps and layer them, some of those things will become more clear. Some of them may raise more questions. That's what maps do. And so it's important to look at them in the context of not just one issue, but multi-issues happening at the same time.
Right, and it's not an individual thing, so individuals might have the ability to basically rise above whatever the level is in their own area. And like I said, overall, we are really doing very well on life expectancy. 80.1, which is the life expectancy for a child born in Lancaster, is really on par with some of the best outcomes in the world. Monaco is, I think, 89. And if you get to 80, you're doing really well. So it's just that as when we looked at the neighborhoods and we started looking at all those factors that are hitting different parts of Lincoln, it was pretty obvious that some things kind of coincided. Not always can you say that, though. I mean, in some cases you actually have good outcomes in one census tract, and right next door you've got really bad, and you kind of go, what's the difference here? Because they're not that far apart geographically. What factors are involved?
Yeah, and I think obesity is a great example of being able to look at an issue that has multi-factor reasons for it occurring in a particular neighborhood. But if we look at it overlaying poverty, for example, there's a strong correlation there. What it does as a community is it says we have limited resources. We only have so much funding, so many human resources to put into a particular issue for our community. So what's great about maps is it says now we know where to go and address it full force. We can say let's go there and really work at it hard in this particular neighborhood or in this particular census tract. And that's what allows us to spend our resources more effectively and our human resources more efficiently.
What's the next step? How are you hoping this report will be used within the community?
Well, the first thing we hope is that when people look at the maps, they see lots of opportunities. We do a lot of things really, really well in Lincoln. And I think when we set our goal as an organization to have the healthiest community in the nation, a lot of people thought, oh, how could that ever happen? But the fact is it has. We're on the top of many lists as being one of the healthiest, if not the healthiest city in the nation. So we've done some extraordinary work. So I think what these maps say is there are opportunities to get even better, and there are opportunities to look at how things other than health care impact our health. So for example, how does where you live or whether or not you have access to parks or good sidewalks, whether or not you feel safe in your neighborhood, whether or not you have adequate access to food or healthy food, whether or not those things play a role in it. So we're looking at beyond just looking at what happens in a doctor's office or what happens in a hospital, but what's happening in our neighborhoods and our schools, and that's really how we create this opportunity to make us even healthier than we already are.
Great. Now, where can the public go to learn more about these maps and this project as a whole?
Well, I would encourage everyone to go to our website, which is www.chelincoln.org, and you'll see there information on this project. We're hoping by the end of the summer to have many more maps up than we already have there, but there will be a chance to become interactive with the maps, to be able to look more specifically at issues that people in the community are interested in. And so if you go to our website, you'll find out lots more about the project.
Great. Well, thank you both for joining us. This is a really eye-opening project and I think a great tool for the community.
Thanks, Clover.
Thank you. When we return, we're going to learn more about how you can reduce obesity by what you drink. Welcome back to Shape of the City. I'm Clover Frederick and I'm your host. One of the biggest contributors to the current obesity epidemic in our country is calories we drink. Today we will learn about a healthy beverage initiative going on right here in Lincoln from our guest Tami Frank from Partnership for Healthy Lincoln and Tonya Vhylidal from WorkWell. Thank you both for joining me.
Thanks for having us.
Well, we'll start with Tami. What exactly is the Healthy Beverage Initiative and how did it get started?
Well, it started really as kind of a public awareness campaign just to educate people to know that sugar-sweetened beverages are the #1 contributor to added sugar in the American diet. Nearly 50% of added sugar comes from sugar-sweetened beverages, which is why we focus our efforts on education around healthy beverage choices, as well as making policy, systems, and environmental change to make the healthy choice the easy choice. And there were a lot of other communities across the nation and organizations like the CDC that were promoting similar campaigns. So we adapted the Boston Public Health Commission's stoplight approach, which is where we came up with our Rethink Your Drink campaign. And we've really found that the red, yellow, and green categories are easily understood across age groups and also across different languages. So red being those that have obviously the highest sugar content, yellow are reduced or no calorie beverages but often contain artificial sweeteners, and then green being the healthiest beverages, with water being obviously the best choice.
Okay, now what are some simple things a viewer can do to drink healthy beverages or even encourage youth to drink healthier beverages?
You can start by swapping one pop or energy drink per day for water. One 20-ounce soda contains 240 calories, which is about 25 pounds a year. So that's one simple change. To encourage youth really is to change their environment is a big portion of it. If you don't have pop or energy drinks in your home, they'll choose something else. And then also just being a role model. They're paying attention to their parents and teachers and what they're drinking.
Okay. Now what have been some of the biggest challenges of the initiative?
Probably the biggest challenge is that with any public awareness campaign, I suppose, is that there are a multitude of ads promoting sugar-sweetened beverages, and with limited resources, it's hard to compete with those, with all those messages. I think from a worksite perspective that Tonya can talk to a little bit too is that while businesses want their employees to be healthy and they want to provide a healthy environment, they have a lot of other things going on that compete with that, and so it's really, I think, finding the right time for them to approach change in their business.
Okay, now how effective has the initiative been? Do you have some success stories you can share?
Yeah, we've had a lot of successes over the 3 years that we've been doing this. This is actually, I think, the 4th version of our board. You should have seen the first one. It was cellophane and foam core and whatnot. But really, we piloted kind of the Rethink Your Drink concept in 3 Lincoln organizations: Lincoln Industries, CHI St. Elizabeth's, and a Surety Life Insurance Company. And while they were already dedicated to providing a culture of wellness for their employees, they reported back that this just helped take them to the next level. CHI St. Elizabeth's actually took out all of they were providing free sugar-sweetened beverages on every floor to patients and families, staff, that kind of thing. And just by taking that out, they saved $27,000 in the first year, so they found an added benefit to that as well. And then as far as other organizations throughout the community, we partner with over 20 community organizations, and they share the healthy beverage message with their clients and staff, students. And for instance, the Malone Community Center took out vending machines out of their center, and now they serve healthy food and beverage options to their kids in the after-school and summer setting. And the kids enjoy it because they get to be a part of the preparation and planning for it.
Great. Now let's talk to Tonya for a bit. What is being done in the workplace setting?
Sure. We have, all of the WorkWell members, there's about 106 members, have access to the toolkit. And we have had multiple focus groups, we've had meetings, we've had one-on-one interactions with many of our businesses. The board itself is incredibly popular. It's made its way to at least 10 businesses already, and it has been taken to several health fairs. So from a education and awareness standpoint, there's been much done with the businesses. Implementation of some of the toolkit practices and the policies and things like that, we're just really getting that initiated now. And we'll have more to tell on that probably in the next 6 months.
Very good. What are some of the challenges you found in getting businesses on board?
As Tami spoke about earlier, it's just that there are so many different things going on that many of the businesses find that the time demand or having the time to do what they want to do and do it well has been more of the issue. From, like I said before, the education and awareness and actually having the board around and using it as a way to demonstrate what's happening with sugar-sweetened beverages has been wonderful, but the actual making the changes, implementing policy systems and environments is a little more challenging. Once we get into the fall, where it slows down a little bit, I think we'll see more activity.
Okay, very good. Tell us about some of the successes that the current businesses who are using this initiative have found.
We have one company in particular, a smaller organization of about 25 or smaller, they have about 23 people, has big use of their Pepsi machine, and Mountain Dew is the favorite drink of that population. So just the education alone, it hasn't completely erased them of getting Mountain Dew out of the machine. What it has done is it's reduced the amount that has been taken out of the machine. And then the organization also supplemented by providing free water. There's water that's free in the refrigerator, and that has been a huge fan favorite with their employees. So just like she said, making small changes, you know, bringing the water in that we added, and it made a small change to the environment, and they love that, and therefore they're drinking less soda. So that's been a key change.
What would you tell a business that's sort of on the fence about starting this initiative?
Yeah, I would just say, just get educated. Give us a call. Find out what it's about. You know, do a little research. Get on the Partnership for Healthy Lincoln website. Look at the toolkit. Maybe even ask us to come out with the board. Give us the opportunity to just show you and demonstrate what it is. And then let's sit down and have a discussion. We're going to meet you where you're at. Nobody's going to force anything on you. It's all about supporting you and guiding you and helping. That's really the key thing.
Very good. Now, if there is a business that's interested in learning more, how do they get started?
If they want to have support at the work site, you're going to reach out to Nicole Osborne, who is our Healthy Choices Coordinator, and she can be reached at 402-483-2511, extension 102.
Very good. Now let's jump back to Tami for a minute. Well, now explain this board to us.
Okay, so as we talked about, the red beverages are those that have the most sugar, and some things that people don't necessarily think of, they obviously, you know, recognize pop or maybe even energy drinks as something that has a lot of sugar. One that always gets people, for instance, the Frappuccino, you have to walk 4 miles to burn that off. The Gatorades, people think, and parents, well-intentioned, think that, you know, their kid's been out playing for 30 minutes, you know, that they've got to have a Gatorade to replenish those electrolytes, when really in most cases water is all they really need. If you're out running a marathon, or you're, you know, in the middle of July when you're really pouring the sweat on, you know, then Gatorade's appropriate. It has its place, but most of the time water will do. Another one is the juice drinks. It's important for parents to, when they're buying juice, to really look at 100% juice. A lot of drinks have 10% and they call it juice. But even with 100% juice, as you see in the yellow category, that's a tiny 4-ounce bottle. And so you don't a lot of time get juice in that. And when you go much larger than that, really you're in the red category, because there's a lot of sugar even in 100% juice. So we always tell parents, really it's better just to give them the fruit than the fruit juice if you're going to make a choice there. So obviously in the green category, water is the best choice. There's unsweetened tea, black coffee. Those are also beverages that are good to go anytime.
Okay, very good. Now tell me what you're doing to promote this project.
Okay, so we've taken this board out to wellness fairs, community events, after-school programs, and whatnot, just to raise awareness. People see it and they either really relate with the amount of sugar that's in there or how far they have to walk to burn it off. So it's been a really effective tool in letting people know what healthy beverage options are available. We also, you might see some billboards that we have around town that tell how far you have to walk to burn off some of these popular beverages. And you'll see that maybe throughout the summer. We're going to also do some bus ads as well. And then with the guide for work sites, there's a lot of promotional materials in there that work sites, anybody can print off. They can put their own logo on it, really customize it to them. There's a brochure, table tents,
Signs.
yep, other things.
all there.
That,
Okay. And what else are you promoting in the future?
one thing that we're integrating into kind of the healthy beverage choices is your first healthy beverage, and that's breast milk. The AAP recommends that infants are exclusively breastfed for the first 6 months of life. And what we found is that in Lincoln, 90% of moms intend to breastfeed. And Nebraska is the 5th highest in the nation for the number of moms returning to work. We have about 77% of moms returning to work. And that's how it comes back to the work site then, because we find we have this great initiation rate, but then unfortunately it trickles off, especially around return to work time. So that's something that we've just started with WorkWell to talk about how we can provide support and lactation support services for businesses to let them know how they can be supportive of moms to reach that goal.
We actually have a collective meeting this week regarding that to get a better understanding from mothers, businesses, the hospitals on what's going on and how can we break down those barriers. So we're excited about that.
Good. Now, if there are individuals interested in learning more about this initiative, how can they do that?
They can go to our website. It's healthylincoln.org, and they can download the guide, which is really short. Most of the resources in there are just that. They're resources and tools to help businesses once they decide that they want to do something about that. And they can also check a board similar to this out through WorkWell.
There's even a brochure that's inside that guide. That's nice. And pop-up tents. Yeah. So
Lots
there's
of
a
promotional
lots of
materials
promotional
in there that they
materials.
can print off and really adapt.
Yep.
Put their logo on. We're open to sharing that with anybody.
Great, that's wonderful. Well, thank you both for coming today. I appreciate it.
Thank you.
Now, stay tuned. When we come back, we're going to hear about some healthy hydration options.
How refreshing is 3 donuts? At least 290 calories refreshing, about the same amount in a 20-ounce pop. And you just biked 6 miles to work that off. Don't undo your game. Learn more at healthylincoln.org.
Hi, I'm Angelina with Let's Move Lincoln, and I'm here to help you drink more water every day. Our bodies are made up of 60 to 70% water. That's dependent on our age and gender. It's 100% necessary to get water throughout our day because it helps with our nutrient transportation and waste transportation where it should go in our bodies. It also helps with digestion of what we consume and also helps regulate our body temperatures, which is extremely important during these hot summer months. So how much water should you be drinking every day? There's a simple way to figure this out. Just take your body weight and divide it by 2, and that's how many ounces you should be drinking every day. Luckily, our water supply in Lincoln is safe to drink right from the tap, but people have trouble drinking just plain water. So, how do we figure out how to be drinking all of that water in our day? We want to mimic the same effects that we have when drinking sugar-sweetened beverages. Sugar and beverages really spark this happy chemical in our brain when we're drinking it. So how can we recreate that happy feeling we have when we drink sugar-sweetened beverages with plain water? Here are my go-to tips for drinking more water every day. Try getting your own personal water bottle. Having your own water bottle is a great tip for kids when they can pick out what they want to drink every day and carry around with them. Next, you can add ice to your water. The coolness will wake up your brain, giving it a little jolt. Drink through a straw. You're using different muscles rather than just pouring it in. Try having an insulated water bottle, especially during these hot months where you're going to sports games. Insulated water bottles will help keep that cool effect going for up to 8 hours a day. Finally, You can add flavor to your water. Nobody is chaining you down to drink plain water every single day. It gets boring. So be a little creative, have some fun, and throw some fruits, herbs, vegetables, and even spices into your water. Some of my favorite go-to flavors are cucumber and jalapeno, and yes, it does add spice to your water, so be sure to cut out the seeds and ribs of your jalapenos if you don't want a very spicy water. Another one is strawberries and limes. Just take off the peel of the lime, especially with lemons if you don't want kind of a bitter taste going on in it. And you can also add in rosemary or basil to have another dimension of flavor to your water. So a popular and affordable flavored water you can do is lime, lemon, and orange. I already cut these up. I washed and cut them, and then we're just going to plop them in our water that already has ice. It's been chilling, so it'll really help infuse the flavor. So we're just going to dump all of these in. Get it going here. So another great tip, besides adding the ice, is to really model or push down on your fruits, vegetables, and herbs so it helps release the flavor and infuse the water. Just give it a quick stir. And you can let it sit, like I said, for about 2 hours. Some might take less than that, but 2 hours is a good time. If you're using cinnamon and apples, that usually takes about a good 8 hours to infuse the water. And then that's it. All you have to do is pour and enjoy. So have fun, be creative, and try what works for you to replace those sugar-sweetened beverages with naturally flavored water.
Shape of the City is dedicated to helping Lincoln stay informed of health and wellness topics and events. Visit our calendar at lincoln.ne.gov, keyword 10health. If you'd like to see your event covered, email us at 10healthlincoln@gmail.com. Thank you for watching. Until next time, get active, eat healthy, and stay informed.